Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. Our apologies for the delay. With us today is the Minister of Health, Tyler Shandro, and Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Minister Shandro will open us off today with an announcement.
Thank you, Tom, and good afternoon, everyone. Today, I want to provide an update on new variants of COVID-19 that are circulating around the world and the challenge that they pose to us here in Alberta in the days ahead. Now, I know this is an important information, so I will use a few PowerPoint slides to help make it as clear as possible. For slide 2, first, it's important here to understand what we mean when we talk about variants. COVID-19 is a virus, and like many viruses, it can change or mutate as it moves through a population. New variants of a virus are expected to occur over time, and we see this with influenza and many other viruses. When a variant emerges, it's not necessarily a cause for concern. However, sometimes a virus changes to the point where it behaves differently, which is when we must watch closely and respond accordingly. Now, in the last few months, several new variants of the virus that causes COVID-19 have been documented. Right now, there are 2 variants of particular concern, first identified in the United Kingdom and in South Africa. Evidence is still emerging, but based on our current understanding, both of these variants are spread through close contact, like the COVID-19 strains that we have seen over the last 10 months. This means the steps that we've been taking since March also help prevent the spread of these variants. Currently, there is no conclusive evidence that these new variants cause more severe illness or that they increase the risk of death. But these variants do spread more easily from person to person, which is why they're more concerning for us. And I'll explain why in a moment. Now, as of today, we've identified 20 cases of the variant first identified in the United Kingdom. We've also identified 5 cases of the variant first identified in South Africa. Virtually all of these cases are directly linked to international travel. However, one case of the UK variant has not so far been linked to travel, and this means that it may have entered the broader community. So let me be blunt. This now is very concerning. Dr. Hinshaw will provide more information on this case in a moment. These variants can spread very quickly. The emerging research indicates that they have a significantly higher infection rate, estimated to be 30 to 50% higher than the strain that we've had in Alberta to date. To see the impact of this, we can look at a number of other jurisdictions, including England and Ireland, both of which have seen variants spread rapidly throughout their populations. Cases have skyrocketed in the United Kingdom due to the variant, and it has now reported the highest daily COVID-19 mortality since the start of the pandemic. Ireland has recently seen a rapid rise in case numbers and in hospitalizations, and this impacts every part of the country. As a result, both countries saw a sharp increase in the number of cases, putting more strain on healthcare resources, leading to more hospitalizations, and ultimately, strict lockdown measures. Now, so far, Canada has not seen these variants spreading in large numbers, but that might be changing. The UK variant that is now here in Alberta has reportedly also been identified in an outbreak at an Ontario long-term care facility. And this outbreak has seen more than 200 residents and staff infected within a few weeks. And more than 30 people have lost their lives as a result of this one outbreak. There's no question that these new variants pose a threat to those who are most at risk, including those who are in continuing care. This is yet another reason that we are taking this extremely seriously here in Alberta. And so what does that mean for us here in this province? Well, we've done some projections looking at what could happen here if these variants became the dominant strains that are circulating here in this province. To be clear, we want to equip Albertans with facts, not fear. These graphs offer a prediction of what could happen if the variant spread rapidly in our province without strong measures in place to limit in-person interactions and transmission. This is not inevitable, but it provides important context to help understand the potential dangers and to respond accordingly. Now, for simplicity, these next few charts focus on the variant first identified in the UK, as there is more data on it. However, these projections would be similar for the other variant of concern as well. Now, first, if these variant strains were widely introduced in the province, over time this would lead to a large increase in the number of new cases that we identify each day. This chart here illustrates that increased infection rate, or what that increased infection rate would look like over 6 weeks. Here, the dark blue line represents the COVID-19 strain that we've seen in Alberta, and the light blue line represents the new variant. So in this example, imagine we start with 250 total active cases in the province and no health measures in place. In about 6 weeks, with the current strain in Alberta, we would see 2,127 new cases being diagnosed every single day. And this is a big number, higher than the peak of about 1,800 seen in December. But if the variant of concern spread unchecked in Alberta, it could produce up to 10,217 new cases every single day within a month and a half. Now, as you can see, the variant spreads far faster than the original COVID strain. And when our projections look at hospitalizations, they tell us a similar story. This graph shows the expected number of hospitalizations over 8 weeks as cases rise. Now, while the two variants do not currently appear to be more deadly than our current strain, we know that when more people contract the virus, we'll see more hospitalizations, and then we will see more deaths as well. If the variant spreads unchecked, we would see more than 3,600 people needing hospital care at one time within 2 months. That's 3 times the number that you'd expect from the current COVID virus that's we're finding in Alberta. Now, the same trajectory is seen in those who would require ICU admission over 7 weeks if the variant takes off. There could be 800 COVID patients in the ICU compared to about 200 at the same time with the original COVID strain. There's no question that this kind of exponential growth would push our healthcare system to the brink. It would significantly impact the healthcare and the services available to all Albertans. And now I recognize that this information may be worrying, so it's important to stress that these projections are only one glimpse of what could happen. They show a scenario where Alberta has no health measures in place to limit transmission. That's the projections that we're showing here. If there were no health measures, what would the spread look like throughout Alberta? They show what would happen if we did not take steps to identify variant cases and to stop their spread in the community. These variants are a challenge that all jurisdictions in the world must now face. But the good news is that there are steps that we are taking to effectively contain these new variants and to prevent community spread. First, we are increasing genetic testing to identify cases of the variant as they arrive in Alberta. Alberta Precision Labs, this is the publicly owned through AHS lab system. APL, Alberta Precision Labs, is enhancing their capacity to do genetic analysis on samples. And the lab anticipates being able to fully sequence 400 samples per week by next week. We're also expanding our rapid screening capacity for mutations of concern. We're targeting having the capacity to screen 300 samples a day by next week. We're also making a change to the border pilot program, which is currently underway. Previously, participants could leave isolation after the first negative test when they arrive at the airport, provided that they sought a second test around day 6 or day 7. Effective immediately, participants must remain in isolation until their second negative test comes back. If either of these comes back positive, that person must isolate for the full 14 days. Now, all of the samples will be analyzed for the UK and South African variants if they test positive through the Border Pilot Project, one of the many benefits that we have through this Border Pilot Project. Travelers currently in the program who have not received the results of their second test must return to quarantine immediately. Last, we are being cautious in lifting the public health measures in place. Albertans have done a phenomenal job in slowing the spread over the last few weeks. Our numbers, while still high, have come down. Things are looking up, and many Albertans are wondering when we can relax the current restrictions. And I hope the information on the new COVID variants I've just presented brings some context to this question. These new variants present a serious threat and a complicating factor when it comes to relaxing restrictions. We need to continue to proceed cautiously, recognizing that our health system is still under significant strain. If we're not careful, our healthcare system could be in a dire situation within weeks, and it would be very difficult to get things under control. We'll continue to work closely with the Public Health Agency of Canada. We're closely following the latest research and developments from around the world to make sure that we stay on top of the new variants. To keep Albertans informed, we'll start posting weekly updates on the variants identified here in the province. And I know that news of these variants, especially given the higher rate of transmission, is distressing. I share this information with you in the interest of transparency and to assure that we are preparing for any evolutions in this pandemic. Fortunately, the research so far is indicating that current vaccines do protect against these two variants. Now, this is good news, and both Pfizer and Moderna are studying the variants closely and looking at ways to adapt their vaccines as it may be needed. And this highlights the importance of getting our most vulnerable folks here in the province vaccinated quickly. As vaccine supply increases and stabilize, we would be able to protect more Albertans from these different strains of COVID-19. But we can't do that if we don't have doses here in Alberta. And as I've said before, we need more vaccine. We have the ability to vaccinate many, many more Albertans and to expand the groups who are eligible. But before we do that, we need the doses here in this province. We've now administered 99,453 doses of the vaccine in our province. And this includes almost 10,000 people who are fully immunized with 2 doses. But we depend on the Government of Canada for vaccine supply, and Canada is being hit harder than others with reduced vaccine shipments. We're receiving 0 shipments of Pfizer vaccine this week, and we're expecting shipments next week to be cut by 78%. We've seen from media reports over the weekend that other countries are being assured by Pfizer that the impact on shipments will be minimal to those countries, but Canada is not getting the same assurance. Just over 2% of Canadians have now been vaccinated. And meanwhile, the US has given a shot to more than 6% of their population. If we compare ourselves to the United Kingdom, more than 10%, and Israel, more than 40% of their population has been vaccinated. Alberta has the capacity to deliver about 50,000 doses per week with the current approach targeted to the specific groups in the first phases of our plan. And we can scale up much higher when we have the certainty of supply for larger populations. It simply depends on our supply. We need more doses now, and we need them more urgently due to the increased threat posed by the new variants. We continue to advocate to the federal government, and as soon as we get more doses, we'll get them into the arms of Albertans. But until then, we must stay vigilant. We continue to evaluate the criteria for relaxing restrictions, and I hope to have more to say in the coming days on those restrictions. And so thank you very much. And I'll now invite Dr. Hinshaw to provide today's COVID update. Thank you, Tom.
Thank you, Minister, and good afternoon, everyone. As the Minister has outlined, the emergence of more infectious variants of concern is an issue that requires close attention. Unfortunately, over the weekend, as you heard, we identified our first case of the B.1.1.7 variant that has no currently known link to travel. This was the only non-travel variant case identified in the over 1,000 samples screened last week by the lab. While we continue to investigate this case to see if we can identify any contacts who may have had a travel exposure, this is a potentially concerning development. It underlines the importance of the work that our lab has been doing to expand their capacity to screen positive cases for genetic mutations of concern. They are rapidly expanding this capacity so that we can ensure that we will detect variants of concern if they are spreading in the province. Turning to today's update. Over the last 24 hours, we have identified 362 new cases of COVID-19 in the province and completed about 7,200 tests. That puts our current positivity rate at 5%. In addition to these cases from the last 24 hours, I want to advise you of some historical cases that will be added to our website today. Due to a technical issue in our case reporting, they are being added later than usual. As you know, Alberta started utilizing point-of-care or rapid COVID-19 tests last month. These are being used in targeted settings where they can help people who have symptoms get tested very quickly. Due to an internal technical issue with reporting of these rapid test results, between December 7th and January 13th, some of the results of these tests were not included in the numbers that we report online. This was an unfortunate error, and we have put processes in place to make sure it does not happen again. We have also added these cases to our online dashboard today. This means that 409 cases have now been added to various days over that 5-week period. It's important to note that this issue impacted our online reporting only. Each of these patients still received their results and isolated during this time, so this did not impact the spread in our province. Also, the change in cases was spread over a long time period, so it would not have impacted any policy decisions. I am mentioning it today because it is important to me that we are fully transparent about the case data that we report. Turning to schools, there are currently 259 schools on active alerts and 9 on outbreak. This represents about 11% of the schools in the province. These schools have a combined total of 500 cases. So far, in-school transmission has been reported to 51 schools, with 39 having only 1 new case as a result. Overall in the province, there are now 637 people in hospital, including 113 who have been admitted to the ICU. Sadly, 25 new deaths have been reported to us in the last 24 hours. These Albertans were between the ages of 41 and 100. My deepest sympathies go to the family, friends, and communities mourning the deaths of these individuals. They loved and were loved and will be missed. As we work to advise on the best path forward to prevent hospitalizations and deaths from COVID-19, as I mentioned earlier, we are closely monitoring for the UK and South African variants here in the province and are watching spread that is happening in other jurisdictions. My team and I are also keeping up with the latest research and developments from across the country and around the world. If additional steps are required to prevent the spread of variants in Alberta, we will take action to do so. Finally, I want to thank the many, many Albertans who continue to follow the public health orders in place. You are the majority, and you are the reason we continue to see promising progress in our daily case numbers, positivity rate, and R-value. Your sacrifices and selfless efforts are making a difference. Through these efforts, our hospitalizations have also declined, but unfortunately they remain very high. This is because hospitalization rates are a lagging indicator, and on average, patients admitted due to COVID-19 have an average stay of 12 days. This can be even longer for the sickest patients who need ICU care. Until our hospitalization rates come down like our other numbers, we need to continue with the measures in place. I know this isn't easy, especially for those whose businesses and work have been impacted, but it's necessary given the continued strain on our healthcare system. That strain has also come with its own hardship and consequences for the many Albertans waiting for scheduled procedures and surgeries. As soon as it's safe to recommend the easing of any restrictions, we will do so. Until then, we need to continue to follow all the measures in place. Thank you, and we're happy to take questions.
All right, we'll go to the phone now. Please direct your question to Minister Shandro or Dr. Hinshaw. Operator, could you put through the first caller, please?
Thank you. James Keller, Globe and Mail.
Hi there. Given what we're hearing with the variants, do you, and this is for the health minister, although Dr. Hinshaw may have something to say as well, do you want the federal government to be putting in any additional travel restrictions? And beyond the changes to the border program that you announced, are there any other measures that Alberta is considering to put its own sort of additional measures on travelers coming from other places?
Well, we continue to make sure that those who arrive understand the resources available to them. If they require help to self-isolate, they don't have the resources to self-isolate, we can provide those resources to those folks. We have made changes in consultation with the federal government related to the Border Pilot Project. Of course, we see a benefit in the Border Pilot Project continuing. Having people test when they arrive, having them test between day 6 and day 7 gives us an opportunity to catch the few positive cases that might arrive across our borders. So we see a benefit to that. Now, we can't force people to swab when they arrive or at day 6 or day 7. We have to provide people with some kind of incentive for them to be able to want to have those 2 tests. Now, we did make the changes that I announced today to have people to continue to self-isolate until that second test. But obviously, we want to continue with the Border Pilot Project because it's going to give us that data and that added protection at the borders.
Operator, could you put through the next caller, please?
Carly Robinson, City News.
Hi, thanks for taking my question. This question is for Dr. Hinshaw. I was hoping to get a bit more of an elaborate update on schools. We saw 2 Edmonton high schools move to online learning because of case counts. I was wondering if there's any change in the school plan or advice given to schools in the new years around pandemic precautions, and what's being done for schools regarding the variant and the reported community spread.
We know that schools, like any other institution, they are vulnerable to community spread. And of course, with the concern about the variant, we're watching that very closely to determine if there may be any extra steps that are necessary. At the moment, with respect to the schools that I'm aware of that have operationally needed to shift to remote learning format temporarily, what we do know is that the measures that we have in place with respect to the formal environments, the in-classroom environments, that those measures do mitigate spread. We also know that when people in times outside of those formal environments, so at break times, lunch times, after school, when they don't follow distancing, when they don't follow continuous mask use, that raises the risk of transmission significantly. And so while schools are currently in open state in person, because there is great benefit to our students and to our society for having our students be able to participate in that in-person learning, it's a reminder to all of us, whether it's schools or any other setting where people are attending in person, that there is no time when we can let our guard down. It doesn't matter if it's lunchtime, break time, after school or after work. Any time that people are together in close contact without using precautions, not wearing masks, and again in a closed environment, the spread of the virus can happen, and that certainly is what we're seeing in some locations.
Operator, could you put through the next caller, please?
Julia Wong, Global News.
Hi, this question is for Dr. Hinshaw, but if the minister wants to chime in afterward, that'd be great. BC released its immunization plan for their province on Friday, and there are lots of different groups of people in our province who hope to be given priority when the vaccine becomes more readily available in phase 2. Now, they range from cancer patients to people with chronic conditions. Dr. Hinshaw, you said that decisions about who will be in phase 2 will be made with an ethical framework. What principles are guiding those decisions, and how will priority be determined?
It's really important as we look at allocating any kind of scarce resource, and in this case, vaccine, to be looking at the individual and collective impacts of how we sequence the eligibility for that particular product. In this case, again, it's vaccine. And so what we're looking at is the evidence we have about who is at the highest risk of severe outcomes from the virus, and who are the people who could potentially expose those other individuals. And so you, of course, know that in our first phase, we used exactly those principles to determine who would be eligible within the first quarter. And those are the same kinds of principles that we're looking at. Who is most vulnerable to severe outcomes, and who is most likely to potentially expose those individuals. And those are the guiding principles we're using right now as we're working through recommendations around sequencing in phase 2 in Alberta.
Thanks. And Julia, just to add on to Dr. Hinshaw's answer, absolutely right that we have to focus on the most vulnerable, but just to remind people that we do have the priority groups for phase 1B. And that's about 250,000 of Albertans who are going to be included in phase 1B. But for us to be able to do that, we need those vaccines to arrive in Alberta first. And then when we make decisions about phase 2, obviously it'd be quite a few Albertans for us to be able to include in phase 2, but for us to understand who should be included and what the priority groups should be and how we make those decisions, we have to first know how many vaccines we're going to be receiving here in Alberta and when we're going to receive them. So this is, again, going back to the question of supply, vaccine supply, and the need for the federal government to step up and be advocating for Canada to be receiving and getting priority, the same priority I should at least request that other countries are getting throughout the world.
Operator, could you put through the next question, please?
Dylan Short, Edmonton Journal.
Hi, this is a question for Dr. Hinshaw. So we have one case of the UK variant, or the variant from the UK. My question is, what is being done on top of regular contact tracing to ensure that this one case doesn't turn into, 10 cases, 20 cases, 100 cases, as we've seen with the original COVID-19? Is there additional steps being taken to trace this one case that we've identified so far?
We are working very closely with local public health to identify any potential contacts and to ensure that they are quarantining, that they are tested. And so we're working not only in that go forward, the important piece about making sure that we are limiting any potential for further onward spread, but also doing that backwards contact tracing to try to understand whether there are any linkages. Perhaps, again, at the moment, we don't know of any linkages to travel, but perhaps there could be, if we trace backwards, some linkages that we currently don't know about. So we're doing both that backwards contact tracing as well as the forwards contact tracing to make sure that we are taking every opportunity to prevent any further spread.
Operator, could you please put through our next caller, please?
Terry Reid, CBC.
Yes, hi, good afternoon. My question is for Dr. Hinshaw. Today, 2 German newspapers are reporting that the efficacy of the Oxford AstraZeneca vaccine may be as low as 8% in those over 65. And just in the past hour or so, the company has issued a denial pointing to its findings in the Lancet. Still, Reuters reporting the European Union Medicines Authority may not approve the vaccine for use in those over 65. Are you aware of any of this? Have you seen the data that is being reported on? And have you heard any concerns about the efficacy of the AstraZeneca vaccine in over 65 from Health Canada or PHAC?
The data that I've seen on the AstraZeneca's vaccine is the publicly reported information on the phase 3 trials. And in that data on the phase 3 trial, we know that for various reasons, there were not as many individuals recruited for AstraZeneca trials who were over 65 as in the other vaccines that are currently licensed. I don't know what impact that will have on the decisions that Health Canada makes about the licensing for the vaccine. But I do know that in what's publicly reported, again, there just were fewer participants who were in that phase 3 trial for AstraZeneca. And of course, that is something that will need to be taken into account as the vaccine is being considered for licensing.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Camilla DiGiuseppe, CTV.
Hi there. Good afternoon. This question is for Minister Shandro, and if Dr. Hinshaw would like to also chime in, thank you. We do appreciate the new information today on the new variants, but some businesses up until now deemed non-essential by your government, for example, restaurants and gyms, are beginning to go against your government shutdown orders and are reopening anyway. Is your government worried that more businesses will follow suit? And given what you said today, that there is no plan on easing restrictions, but is there any plan moving forward for these industries, and so that they don't jeopardize their own futures? As we have heard loud and clear from them, many feel that your government has been, quote, non-existent when communicating with these industries.
Thanks. First of all, we have not made any distinction about essential versus non-essential with these measures that were announced in November and December. So just first of all, to clarify that. And I actually think that in the spring, when we made that distinction, like other jurisdictions did throughout the world when they imposed their measures in the spring, I think that was a mistake in making distinctions between essential and non-essential. What we've done with these measures and what we're going to be doing going forward as we ease restrictions, like we did, I guess it was a week and a half ago, related to personal services, is about risk. And so all of these activities, including activities that happen within a business, all have different levels of risk. And what we have to do as a government is assess the various levels of risk that these activities might pose to the community, and easing restrictions depending on our hospitalizations and other metrics. And we'll continue to do that, continue to look at our hospitalizations, because that's our focus. We've said as a province, we're not chasing zero with our cases, but our focus with the November and December measures was to deal with the pressures on our healthcare system, to make sure that people who are critically ill continue to get the care that they need, people can continue to get the surgeries that they need, and that was our focus. Now, depending on our hospitalizations, what will we be able to ease for the various activities depending on the risk? And that's what we're going to be doing in the coming days. As I said earlier in my announcement today, is that we hope to make some announcements going forward. We understand that a lot of businesses have anxieties, and our hearts go out to all businesses who are affected by these health measures. There are many businesses as well who may not even be directly affected by the health measures, but indirectly because the economy is affected. We understand that. And we understand that the balance of the restrictions against the social and the economic consequences of them. But our focus is going to be on a risk-based approach, not essential versus essential. And we're going to continue to work with those industries, including with the restaurants and hearing from Restaurants Canada, to be able to come up with a go-forward plan for those businesses and how we can move forward in easing restrictions and how people can better understand how and when those restrictions would be eased.
Operator, could you put through our second last question, please?
Vincent McDermott, Fort McMurray Today.
Hi, this is a question for both Minister Shandro and Dr. Hinshaw. Alberta Health has sent me the number of COVID cases in the oil sands linked to current outbreaks, but not out-of-province commuters that have tested positive while working in Alberta, even though this transient workforce is in the tens of thousands. So I know there are plans to release industry-specific COVID numbers at some point, but how reliable would this data be if transient workers at large workplaces like the oil sands or even in agriculture are not reflected? And also, how come this data has not been released already?
Dr. Hinshaw?
Thank you, Minister. When we report on outbreaks on our website, so we do have a cutoff for when we report outbreaks publicly, And when we report numbers linked to outbreaks, those outbreak reports do, in fact, include those cases that may be in somebody who lives in another province but traveled to Alberta to work and who acquired infection while here. So those numbers should be included. So I'll follow up, maybe we'll follow up offline just to make sure that the information that you have is consistent with what I understand we do report publicly already with respect to our outbreak reporting on our website. And then the question about whether or not the numbers, as we move to looking at sector-specific numbers and trying to demonstrate to Albertans the different transmission events that we've seen happen in different sectors. Again, the majority of cases that we are seeing are cases that are here in Alberta and not necessarily those that are coming and going. But when there is a specific outbreak, again, we do capture all of those together in that number.
All right, operator, could you please put through our final question?
Thank you. The final question is from Carrie Tate, Globe and Mail.
Hi, my question is for Dr. Hinshaw. Can you tell us a little bit more about the testing for the variant right now? How much we're testing, the expansion plans, the speed at which those results are turned around, and for the one positive test of the UK variant that came back, was that a random sample? Was there a reason that one was sent for sequencing, or was it just sheer luck that we now know about it?
So the lab has a protocol for testing samples. Since the beginning of the pandemic, we have had a sampling protocol for full genetic sequencing for selected cases. So the lab has been doing testing on an ongoing basis, particularly focused on outbreaks. And since October, the lab has been doing around 150 samples every week with a full genetic sequence. And when we saw the variants of concern start to emerge in late December, the lab added some additional types of testing to that. So they are doing two things. The first thing they're doing is they're increasing the number of samples, positive samples, that they do full genetic sequencing on, up to being able to test 400 positive samples every week. And full genetic sequencing looks at the entire sequence and would be able to detect not only the variant of concern, but also if we were to see any genetic variations that might emerge here in the province or that would be linked to other places and would be new variants that we need to watch. In addition to that, the lab, by the end of this week, will be able to test approximately 300 samples every single day with a faster screening test that will look specifically for the mutations in the variants of concern, and they will be able, therefore, to do a very deliberate sampling methodology that is able to look at samples from across the province, look at different age groups, look again focusing on outbreaks, having samples from outbreaks screened so that we would be able to pick that up. With respect to the one case that we have picked up, the lab started an earlier version of this screening process, this rapid screening process, and did test over 1,000 samples last week with that same kind of approach, looking at geographic variation, age variation, looking at a sample that would be likely to catch a variant if we did have it spreading in the province. And of all of that testing, this was the one sample that did come back positive. So it was a result of that screening process based on that screening frame that has been planned to be able to have the highest likelihood of detecting variant cases should they be circulating in the province. And as I said, the lab is increasing its capacity, so they will be doing even more of that testing going forward.
Thank you all for joining us today. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.